What up, YouTube? So we're just gonna get right into the video. Actually, before we do, I'm gonna need you guys to like, subscribe, alright, and leave a comment too. I'm gonna be making a ton of videos on how to make this ISSA exam as easy as possible for you guys to pass, alright? So I'm gonna give you guys as much information as I can. So let's just get into it. This is gonna be an extension off of my first video that I did, which was ISSA exam, what's on the test. Alright, so we're going to start with, I said the three most important things that I saw the most questions on the test personally were, three was special populations, then the next was nutrition, and then the first thing were the training principles. So this video, we're going to get right into special populations, alright? The thing is with special populations, I believe there was 10 different sections, very short sections, maybe 3-4 pages max. So we're gonna get into it, all right? We're gonna get into it, starting with one, youth. What you would need to understand about youth in order to pass this test were training considerations. I'm pretty sure an exact question was, why can't you train, let's say, someone from the ages 5 to 12, why couldn't you train them as intensely as you would train an adult? And the reason for that is that they have immature skeletons. Their bodies won't react the same way an adult would. An adult's body and muscles and bones would react. So it's always important to go very low, moderate, and stick to a specific training skill. Okay. Another thing to know about youth is I saw that you're going to definitely need to differentiate ages 5 to 12 and then ages 12 to 17. I'd give you guys more information, but we gotta move on to the next thing, which is hypertension. This I saw a lot on hypertension. All right, so you definitely need to know the definition, and you'll need to know that 60 million Americans suffer from hypertension. It'll give you information. You'll definitely need, there will be questions on designing a program for somebody with hypertension. Designing a program for somebody with hypertension will go off of their RPE. You'll need to know what exercise intensity that they will be allowed to go at and how long. We start off 20 to 30 minutes, all right, and then once they get more comfortable, maybe you start low, and then maybe you can go into the more moderate range. All right, got my notes here for you guys, all right, so put in that work. I'm definitely gonna need that like and that subscribe, all right? Next was diabetes. There was a lot on this. I got a lot of notes here on diabetes. So you'll definitely need to know the difference between the two types, okay? The two types, type 1 and type 2 diabetes. For a question that I remember off the top of my head is the duration of time that you should be training them. So I know for type 1 it should be 20 to 30 minutes, and for type 2 it should be 40 to 60 minutes. Okay, so I know that might have been a direct question on the test, actually. How you should monitor blood sugars before and after, you're going to need to know that. Definitely taking blood sugar, knowing basically what's high, what's low, what's okay for them to train at. Okay, next we got intensity, all right, and where should your max heart rate be while training? And it should not go higher than 85% for somebody with diabetes, and it should not be lower than 55%. All right, so it should be low to moderate intensity. All right, temperatures, what weather is okay for them to be training in? All right, so it should not be anywhere higher than 90 degrees. All right, 90 degrees is way too much. You should not be training a person with type 1 or type 2 diabetes outside if it is going to be over 90 degrees. And what you need to do in case of an emergency for somebody with type 1 or 2 diabetes, be proactive, have a juice box, have some type of fast acting carbohydrates, candy, whatever you need to do. Next, we got arthritis, all right? Wasn't too much on arthritis from what I remember, but definitely a few questions. Need to know definitely just the main definition, all right? So once you just Maybe that'll be in the first paragraph. You'll probably need to define it, and then you'll need to know how frequently somebody with arthritis should be exercising, which is, I think it's 2 times a day to be exact. But 2 times a day to stop the muscles from continuing to get stiff, and you'll need to know why they get stiff and all of that. Next, coronary heart disease, okay? This was extremely important. There was a lot on this, but pretty short. I think it was only 2.5 pages, but you need to define it. You need to know 950,000 people die every year from coronary heart disease. You'll need to define stroke. What happens for coronary heart disease to take place, and how it can lead to a stroke. Which has to do with how a buildup of lipids in the bloodstream is what starts coronary heart disease. So you need to know that. Next, we got pregnancy. What position should you avoid having a pregnant woman lay in, which is the supine position, right? Which is laying on their back. You should never have a pregnant woman laying on her back. When is a good time to stop training a pregnant woman? You will also need to know that you should always have them be at a low, moderate range. We're not trying to, kill pregnant ladies out here, all right? So let's keep it at a very low rate. And 20 minutes, only 3 times a week for pregnant women. Next, asthma. You need to know what happens during an asthma attack, okay? Which you'll find it in the book real easy. What happens during an asthma attack, you'll need to know that, and you'll need to know what to do during an asthma attack. But sure, the answer is just wait it out. Asthma attacks usually resolve themselves. It's 30 to 60 minutes, I think was what was said in the book, which is, I've seen asthma attacks. Like, personally, I've seen them, and it'll be like 5 minutes, but go off what the book says, all right? The book says 30 to 60 minutes, so go with that. You'll need to know more on asthma, actually. More on asthma. Managing asthma, okay? You'll need to know what a peak flow meter does, what a spacer does. A peak flow meter tracks how fast air is getting to the lungs. A spacer measures the inhaler, the medicine from the inhaler, how much it's getting to your lungs and how much it's helping you. You guys are gonna have to go back and definitely check that. You gotta remember, stay away from cold weather. All right, if you're gonna be in cold weather, someone with asthma needs to cover their mouth. All right, you'll need to know that. You need to know to drink a lot of water and control breathing to prevent hyperventilation. Next, all right, and finally, we have the introduction to sports medicine. This was the last one that I feel like I needed to speak on, that I thought there was enough information to go over. So ready? This is a lot. You'll need to know what to do when your client are feeling these things: weakness, fatigue, dizziness or vertigo, cough or shortness of breath, abdominal pain, bleeding, leg, hip pain, ankle and foot pain, and shin splints. I mean, you don't have to go too crazy knowing all these things, but there is a little section, I think it's just 3 things to know. What you need to do when you need to have your client call a physician. All right, so when it's kind of out of your hands and you're like, hey, you need to speak to your doctor about this. Usually for most of them, it was when any of those things that I listed, so weakness, fatigue, leg pain, hip pain, like whenever those things are stopping you from, let's say, walking, or it's hard for you to breathe, or things like that. That was mostly them, but just know that you're gonna see that section in the book, like when to call a physician. So you'll need to know those. You'll need to know those. The advice that you're gonna need to give to clients is when to use heat therapy, cryotherapy, ultrasounds, and hydrotherapy. All right, those are things that you're gonna need to tell your client, hey, hydrotherapy is good for this, or cryotherapy is good for this, or heat therapy is good for this. All right, so you definitely need to know that. The last thing is how to avoid these things from happening, which is lower back pain, shoulder pain, elbow pain, and knee pain. Okay, so you're gonna need to know how to avoid those things and what to do if someone's dealing with those things. All right, and basically, I think, I mean, it said it in a bunch of fancy words or whatever, but I think the solution is pretty much increasing flexibility and increasing range of motion. Those are the two most important things that you're gonna need to do. But of course, you know, go back into the book, make sure, you know, you guys read up on it, read up on the exact words, because everyone has a different way of studying, you know. So yeah, I hope this video was really helpful. Don't forget to like, subscribe, and leave a comment for any more questions, any more video ideas that you guys want from me. You know, let me know, and I'll be here to help. All right, good luck on that test. Peace.